Question 1. A 45-year-old man with a long history of alcohol use presents to the emergency department with confusion, a fruity odor on his breath, and difficulty breathing. His laboratory results show elevated lactate levels, anion gap metabolic acidosis, and decreased glucose levels. Which of the following mechanisms is most responsible for his condition, and which of the following treatments is most appropriate? Choices. A. Increased NADH-NAD plus ratio, treat with glucose and insulin. B. Increased NADH-NAD plus ratio, treat with thiamine. C. Increased acetyl-CoA, treat with fomepizole. D. Increased NADH-NAD plus ratio, treat with ethanol. E. Decreased NADH-NAD plus ratio, treat with bicarbonate. Answer. Increased NADH-NAD plus ratio, treat with ethanol. Explanation. This patient presents with signs of alcoholic ketoacidosis or alcohol-related metabolic acidosis due to chronic alcohol consumption. The increased NADH-NAD plus ratio in the liver results from the metabolism of ethanol by alcohol dehydrogenase, which inhibits the TCA cycle. This shifts the metabolism toward ketogenesis, lipogenesis, and lactic acidosis. Treatment with ethanol prevents the conversion of alcohol into toxic metabolites, and it helps restore normal metabolism by acting as a competitive inhibitor of alcohol dehydrogenase. A. Glucose and insulin would help in the management of insulin resistance or diabetic ketoacidosis, but this is not the correct treatment for alcohol-induced metabolic acidosis. B. Thiamine is important in the treatment of Wernicke-Korsakoff syndrome in chronic alcoholics, but it does not treat the underlying metabolic acidosis. C. Fomepizole is used for methanol or ethylene glycol poisoning, but not for alcohol-related metabolic disturbances. E. Bicarbonate is typically used in cases of metabolic acidosis, but it is not the primary treatment for alcohol-induced acidosis. Question 2. A 50-year-old woman presents with confusion, muscle weakness, and abdominal discomfort after drinking excessive alcohol over the weekend. Her laboratory results show an elevated anion gap and increased lactate levels. Which of the following pathways is most likely being inhibited in this patient due to an increase in the NADH-NAD plus ratio? Choices. A. Gluconeogenesis. B. Fatty acid oxidation. C. TCA cycle. D. Glycogenesis. E. Protein synthesis. Explanation. The increased NAD-ND plus RES ratio in the liver during alcohol metabolism inhibits gluconeogenesis by preventing the conversion of oxaloacetate, OAA, into phosphoenolpyruvate, PP. As a result, glucose production is impaired, leading to fasting hypoglycemia. The inhibition of gluconeogenesis is one of the mechanisms responsible for alcohol-induced hypoglycemia. B. Fatty acid oxidation is promoted in some conditions, but is not inhibited by the NADH-NAD plus ratio. C. The TCA cycle is inhibited by the increased NADH-NAD plus ratio, but this question focuses on the impact on gluconeogenesis, which is more directly affected by the imbalance. D. Glycogenesis. The formation of glycogen is not primarily impacted by the NADH-NAD plus ratio in this context. Protein synthesis is not directly affected by the increased NADH-NAD plus ratio in the context of alcohol metabolism. Question 3. A 40-year-old male presents with confusion, weakness, and a fruity odor on his breath. His laboratory results reveal metabolic acidosis with an elevated anion gap and high lactate levels. Which of the following is most likely contributing to his condition in relation to alcohol metabolism? Choices. A. Increased fatty acid oxidation and decreased gluconeogenesis. B. Decreased lipogenesis and increased ketogenesis. C. Decreased lactate production and increased glucose utilization. D. Increased NAD plus NADH ratio and increased TCA cycle activity. E. Decreased NADH-NAD plus ratio and increased gluconeogenesis. Increased fatty acid oxidation and decreased gluconeogenesis. Explanation. In this patient, the NADH-NA plus ratio has increased due to alcohol metabolism, leading to several downstream effects. 1. Increased fatty acid oxidation and lipogenesis, contributing to hepatic steatosis, fatty liver. 2. Decreased gluconeogenesis, which results in fasting hypoglycemia. 3. The shift in acetyl-CoA metabolism toward ketogenesis contributes to ketoacidosis. B. This option is incorrect because the NADH-NAD plus ratio inhibits the TCA cycle and promotes the diversion of acetyl-CoA into ketogenesis, not lipogenesis. C. Lactic acidosis, not lactate production decrease, occurs due to the accumulation of lactate in the blood. D. The NAD/NAD+ ratio inhibits TCA cycle activity, not stimulates it. E. The NADH/NAD+ ratio inhibits gluconeogenesis, not promotes it.